What are the first signs of a brain tumor? In this video, I'll talk about a specific tumor called prolactinoma, which produces the hormone prolactin. Due to increased prolactin production or hyperprolactinemia, you'll experience various effects on your body, which I'll explain. It's crucial to notice all signs, as they're often overlooked, even by patients unaware of this prolactin increasing condition. These signs often go unnoticed, Unaware of this tumor, patients don't seek help, accepting it as normal, but you'll see it's not. Delaying treatment allows tumor growth, worsening outcomes, and potentially causing irreversible effects. So, what's the first sign of this prolactin-producing tumor? First, I want to highlight that by increasing prolactin, it can disrupt pituitary hormone production, reducing sex hormones like testosterone in men and estrogen in women. In women, this tumor can cause infertility and alter menstruation, leading to amenorrhea, when a woman stops menstruating despite not being in menopause. This is crucial to understand. Why did I mention this first? Because many women don't seek help when they stop menstruating. They only do so when they start experiencing various other signs and symptoms. Often, when I see patients with high prolactin levels, I ask, "How long have you not been menstruating?" Many say 6 months, 8 months, or 10 months. Some even say years. "Oh, I didn't know it could be serious." So if you're not menstruating, know that you need to get it checked out. Not just prolactin-producing tumors, but other conditions like PCOS and various hormonal and metabolic changes can lead to missed periods. One possible cause is increased prolactin levels. What happens in men? They may experience infertility, low sperm count, and reduced testosterone, leading to hormonal imbalance. This can cause gynecomastia, low self-esteem, muscle loss, and even nipple discharge in both sexes. There are normal situations where prolactin levels increase. In fact, several things can cause this. What's the normal physiological situation during pregnancy and breastfeeding? So women naturally increase prolactin to produce milk. Now, when milk starts leaking unexpectedly in women outside of pregnancy or breastfeeding, and even in men, it's a major red flag. What's a normal prolactin level? We consider up to 23 nanograms per milliliter normal. Besides prolactin-producing tumors, other factors I mentioned include medications like antidepressants, mood stabilizers, blood pressure meds like verapamil, and anti-nausea drugs like metoclopramide. So various medications can cause this. That's why doctors must discuss thoroughly and not assume every prolactin increase is a tumor. So, if your test shows high prolactin, remember there are many other possible causes. Another common one is due to friction or physical stimulation. For instance, I had a patient who was a runner. His test showed elevated prolactin levels. He ran wearing a shirt with a rough inner design that stimulated his nipples. The inside was a bit abrasive. Often, this can also cause an increase in prolactin. Some bra types can also lead to this increase by creating nipple friction. It's always important to consider this possibility. This condition, a prolactin-producing tumor, typically causes a more significant elevation. It's not just slightly above normal, like 25 or 27, if the normal range is up to 23. Values can be over 200, 300, sometimes even more than 1,000. This pronounced change causes hormonal imbalance, inhibiting FSH and LH production. I just spoke very technically, but these hormones stimulate our sex hormones, testosterone, estrogen, and the signs and symptoms I mentioned. Let's move on to the video, which is sign number 2. This sign is related to the tumor's size. If the tumor grows, it can compress the optic chiasm, which is crucial for image formation and our vision. What's the characteristic of this visual change, which can be caused by a prolactin-producing tumor, the prolactinoma? It's a change in peripheral vision. Let me break it down for you. You'll have trouble seeing things on the sides, your peripheral vision. Your central vision will be fine, but on the sides, you'll start having trouble seeing because of what I explained. So, visual changes should raise red flags, as they could be from this growing tumor. Just to note, there are other more aggressive types of brain tumors too. This prolactin-producing tumor is typically benign. Do you know the difference between malignant and benign tumors? Benign tumors don't spread to other areas like the liver or lungs, so this tumor is classified as benign. That doesn't mean it's harmless. It can have serious effects. Untreated vision changes, even from benign tumors, can cause permanent blindness. So what I'm saying here is really important. And the third sign is headaches. Pay attention to headaches that gradually get worse over time. Never had headaches before, but now you do. It could be due to this tumor. You've had headaches before, often episodic, sometimes triggered by something. Now they're intensifying, worsening. It's a progressive headache that keeps getting worse. We need to investigate if there is an underlying cause, okay? Many people who are used to headaches often overlook this warning sign, but I'm going to emphasize the progression here. The headache is getting stronger. Whoa, that's a red flag because there are other causes besides prolactinoma that can trigger this. Only through tests can you identify what's really going on. Sign number 4, thyroid changes. This sign is curious. I'll explain why. There are 2 main thyroid disease groups. First, most common, the thyroid itself malfunctions. Second, a change in the pituitary, which controls the thyroid remotely, regulating hormone production. A prolactin-producing tumor can cause central hypothyroidism. The thyroid's healthy, but becomes sick due to faulty control. Tests provide a big clue to pinpoint the issue. I'll show a table with values to explain better. What's this major clue? When there's a thyroid issue, the T4 hormone level will be low. However, the pituitary hormone that regulates thyroid function, TSH, will be elevated, as you can see. Now, with a regulation problem, free T4 will also be low, indicating hypothyroidism, but TSH won't be high. Instead, it'll be low or inappropriately normal. The relationship will be off. Why? The pituitary can't detect low hormone levels to boost production. So, even if TSH is within range, combined with low T4, it indicates a central problem, an issue with regulation or TSH production. Prolactinoma can be one cause that affects TSH production. This can lead to various signs and symptoms. What are these signs of thyroid problems? You may experience constipation and your heart rate might slow down, a condition called bradycardia, with less than 60 beats per minute. You might also feel more sensitive to cold, notice brittle nails, hair loss. These are signs of hypothyroidism. I won't go into detail here, but I want to highlight this hormonal change typical of central nervous system issues called central hypothyroidism. Did you know about this? If not, wasn't that like worth it? I didn't set a like goal earlier, so let's aim for 20,000. Each like means one more person informed. You've seen how crucial time is when dealing with brain tumors like prolactinomas, and the 5th sign is fatigue. This fatigue symptom is quite general. It could be anemia or vitamin deficiency, but I'll also add nausea as a sign. A person who's always tired, weak, sometimes nauseous due to compression can exhibit this nausea symptom. Also, hormonal changes occur, like testosterone changes in men causing fatigue, and progesterone and estrogen in women. So, yes, fatigue is one of the signs and symptoms present when it comes to this tumor I'm explaining. You wake up tired, feeling like you can't get any rest. You could climb 4 flights of stairs before, now you're exhausted after just 1. It's definitely a warning sign and shouldn't be ignored. As you've seen, it can worsen. The 6th sign is weakness in the bones. Wait, what do you mean by weakness in the bones? I'm using very clear language here. Changes in bone density can occur, leading to osteopenia or even osteoporosis due to hormonal imbalances. Growth hormone produced in the pituitary gland is present in adults and the elderly, not just children. Many people think only children have it. No, we produce it throughout our entire lives. This tumor can affect production, lowering growth hormone levels. Growth hormone is crucial for bone health. Testosterone, sex hormones, and estrogen are also important. These hormones are vital for bone formation and health. So, if you have an imbalance in these hormones, it can lead to bone weakness, manifesting as osteopenia, increased fractures, or osteoporosis. Therefore, it's crucial to check these hormone levels when you have weak bones. In my practice, I often see patients referred to me as an endocrinologist after they've already had 2 or more fractures. However, the first unexplained fracture, especially a low-impact one, should prompt investigation. For instance, falling off a tall ladder and breaking a bone is understandable. But a vertebral or femur fracture from low impact isn't normal. It needs immediate investigation, as it could indicate a serious disease or hormonal issue. The same applies to abnormal results in bone density scans. Often the patient's bone mineral density is very low, with bones too weak for their age. This requires investigation, as various hormonal issues can cause this, like high prolactin hindering production of bone health hormones. Sign number 7 is curious. This tumor can alter cortisol production. So, what are the signs and symptoms of reduced HTH hormone production? You might have very low blood glucose, leading to drops in blood sugar levels. Pressure changes are curious. Unlike others causing high pressure, this can lead to hypotension, making patients faint. There's also orthostatic hypotension when standing up quickly, requiring reduction in blood pressure meds. If someone took many BP meds before, they might now faint from stopping them as pressure drops. So, we need to evaluate the cortisol changes I explained. Another sign that can occur, which is more specific but worth mentioning, is an increase in blood potassium and a decrease in sodium. Also consider the possibility of a cortisol issue, like low cortisol caused by a brain tumor disrupting HTH hormone production. I know this part got very technical. I don't like speaking this way, but it's necessary to explain properly. Let me know what you think of the video. Do you enjoy content like this? Sign number 8 is increased anxiety and even mood changes like depression, as these hormonal shifts affect mental health too. Now, I have some good news for you. If you've stuck with the video this far, you'll be relieved to hear what I'm about to say. Why? When a prolactinoma is identified, the first choice is medication, typically cabergoline. This drug targets the tumor, reducing its size and normalizing it, improving symptoms if caught early. Unlike other tumors that require surgery, prolactin-producing tumors are usually treated without surgical intervention. Knowing the signs and symptoms is key. Often, medication alone is enough without surgery, chemo, or radiation therapy. Simply taking medication can often normalize the condition. As this tumor doesn't spread, treatment is often successful with just medication, having few side effects and improving quality of life. Interesting, isn't it? So subscribe to the channel now to keep up with new videos and turn on notifications. On a scale of 0 to 10, how would you rate it? After that final bit of news, it's got to be a 10. For this one, I won't accept anything below a 9, deal? I'll leave a video suggestion for you to watch. It's about 8 nighttime habits that can increase your risk of having a stroke. Are you doing any of these habits? Click this video to learn about these common nighttime habits many people do. Take care. See you next time.